Right now I'm going to be discussing beta blockers. And beta blockers are really important classification of antihypertensives, but let's remember that they actually stand for beta adrenergic blockers. Oops. And what that means is that they essentially block adrenaline, and it's going to be on the beta receptors, which is smooth muscles. You really find a lot of an abundance in blood vessels. And so you have to understand a couple basic elements. Adrenaline by itself, so I'm gonna draw it in parentheses right here. Adrenaline, catecholamines, epinephrine, norepinephrine, they typically vasoconstrict. Okay, they vasoconstrict, they normally increase blood pressure. Okay, so by giving somebody beta adrenergic blockers, what we're doing is we're blocking the effects of adrenaline on the blood vessels, which therefore vasodilate, open them up, and it reduces blood pressure. Okay, that's one of the first things you guys really have to understand and distinguish. Adrenaline causes hypertension, and beta blockers, the way that it reduces hypertension is by blocking the effects of adrenaline on the smooth muscles of the blood vessels, on the beta receptors. So, what these medications do, you have to remember, first of all, they all end in LOL, metoprolol, atenolol, sotalol, things like that. As a student, you have to be keenly aware of how this is going to affect the system, because we all know, okay, beta blockers, they're antihypertensives, but if they block adrenaline, well, adrenaline has an effect on the heart rate, right? Normally, adrenaline increases the heart rate. So, because we understand that these medications block adrenaline, it's going to cause as a side effect the heart rate to go down. So, we must assess the heart rate before we give the medication, and it should be at least 60 beats per minute before we give it. Moving forward, if we are giving beta blockers, you have to remember that the B for beta blockers, I want you to remember B for bronchospasms. That is a sensitivity that the patient may have. If a patient has asthma, you have to be careful when giving beta blockers because it may cause bronchospasms, which may lead to respiratory difficulties. At the same, so we've discussed 1, assess the heart rate. 2, be careful for bronchospasms, right? And then the third thing I really want to focus on is the patient who is diabetic. The diabetic patient. On a sidebar, you have to remember that a patient who's diabetic, they may develop hyper and hypoglycemia. But right now we're going to be talking about hypoglycemia. You have to take precautions with your patient who is diabetic and who's also taking beta blockers, because the signs and symptoms of beta blockers, the signs and symptoms of hypoglycemia are facilitated by the activation of the sympathetic nervous system. Sympathetic nervous system. Whoops. Sympathetic nervous system, right? When you have an activation of the sympathetic nervous system, that's your fight or flight. That's going to increase your heart rate. That's going to make your hands cold and clammy. This is where all the side effects of, or the symptoms of hypoglycemia come from. When somebody develops hypoglycemia, the cells require sugar for energy, but since there's not enough available sugar to go inside the cell, the body activates the fight or flight mechanism, and that's what gives you your side effects, your signs and symptoms of hypoglycemia: nervousness, tachycardia, tremors, cold, clammy skin, things like that, the feeling of apprehension and stuff like that. Well, in your diabetic patient who is also taking beta blockers, well, there's a problem now, because when the blood sugar drops and the sympathetic nervous system is activated, well, aren't these medications going to block adrenaline, which is essentially what activates the sympathetic nervous system? The answer is yes, it's going to block it. So you're going to have a hard time noticing the signs and symptoms of hypoglycemia on your patient who develops hypoglycemia, who's also taking beta blockers. Because of that, you have to remember that beta blockers will mask the signs and symptoms of hypoglycemia, and you have to do AccuChecks a lot more frequently. You have to assess the blood sugar more frequently to make sure that we can see it as an objective symptom or an objective sign, with looking at the value, because we might not be able to see the signs and symptoms being manifested because of this drug.